Thanks, Emma. Okay, thank you for attending the Mental Clinical Practice Placement tonight from MACP. So I'm Sharon. I'm one of the portfolio lead for MACP, and we got Caroline as well tonight.
Hello.
Hello. We're just going to give a bit of the overview of tonight's webinar. We have loads of queries about the mental clinical practice placement of MACP. So we decide to put this together as a webinar tonight to brief everyone the mental clinical practice placement journey, very much from start to finish. But also we would like to share some new resources that we recently developed, such as the practice the placement checklist, very much from start to finish, from for both mentor and mentees, various forms and templates, which very much aims to support both mentors and mentees. It's a great pleasure to have Lucy tonight, Lucy Dove, to share her lived experience as a mentee at the moment. Unfortunately, Sam unable to attend tonight because of some emergency, a family emergency. But we got Lucy tonight, which is great pleasure having her tonight to share her view and experience during her placement. And at the very end, we have an interactive Q&A sections. So hopefully we can answer most of your questions. And we got Emma from MACP to help us to manage our chat box. So it's a very, very interactive webinar. We're here to give you further information of the mental clinical practice placement, and hopefully that will help to answer some of your queries. So to start with, what are some perceptions of mental clinical practice out there, and how may some people see it? And I would probably say that's including myself. As some of you know, I'm a very long-standing teaching fellow of the Society of Musculoskeletal Medicine. For me, with MSCP placement, it's like a lot of people, it feels quite scary and daunting. Some people describe to me like, oh my God, this may be like one of the worst few weeks in my career being watched and observed. So people do feel they're under constant observation and scrutiny. And other perception people do say about how do I balance my usual work and home life. It just feels very overwhelming. How could I do my 150 hours mental clinical practice placement? We do have some clinicians on portfolio routes, particularly they're very experienced, but they haven't got a full MSc, and as a result of that, they would need to do a mental clinical placement, and so some may feel they're not too sure whether this adds any value, or even they need it because they're already a very experienced clinician. So I think this is probably some of the perceptions of the MACP placement by some people. However, now I understand or heard so many positive feedback from the placement. It almost feels like a retreat to me. It's not, if you think about it, it's not that much opportunity and time that you will have time and opportunity to learn and reflect and refine your practice. It's an opportunity to develop your own objectives that you want to develop, and have the opportunity to work with some really experienced clinician and experts. And I heard so many people said this is become one of my most rewarding experience undertaking the placement. So the perceptions may not be what is actually the reality is. So what made the mental clinical practice placement a rewarding and positive experience? The placement is very decided to provide a structured and a supportive clinical placement for MSK professionals. So another thing, which is I think is a unique selling point, is a self-direct learning. So you go in with your objectives, what you want to learn and get away from this placement. And but obviously at the same time, you need to benchmark this with the IFOM standard. So as much as what you want to learn through your self-direct learning contract, it's just really important to set their own objectives, which is balance and overarching that learning outcomes of the mental clinical placement. The placement also give you an opportunity to benchmark your clinical practice. So your clinical skills is mapped against the IFOM standards. Um, Placement also give you an opportunity to learn from experts and experienced clinicians. So, for example, if I want to develop my spinal area, I would like to maybe learn from an expert during my placement and or learn from certain experienced clinician who is very good in that area. And time to reflect and refine. As we know, we are very, very busy with our clinical work, often firefighting with waiting lists. But having a placement is having time aside to reflect and refine your own practice. I think I've mentioned this point, which is a self-direct learning contract. So you very much as mentees set their own objectives during your placement period. At the same time, obviously, have to refer to the learning outcomes of the mental clinical practice placement, which is the Dimension 10 IFOM standard. And finally, placement is very much nurturing professional growth in advanced practice in MSK. And that is the whole objectives. And I think as you all experience, we do learn a lot during and in clinically in the clinical environment. So that is definitely is one of the objective. And I think that makes this a very rewarding and positive experience. Apart from being a rewarding experience for mentee, it is also rewarding experience for mentor. One of our mentors, Sam Simmons, recently done an interview for us to basically share her experience as a mentor. And I think one thing which is very, very memorable from what she said is it's just very nice to be part of someone's journey, become someone to support others' professional growth and development, and opportunity to share your experience. So it's just great to be part of that someone else's journey during their professional growth. Also, it's allowed to develop and demonstrate your educational pillar of advanced practice as a mentor. As you know, MACP is very much, we are one of the visions and missions of MACP is to continue to develop our advanced practice in MSK. So being a mentor really become part of that MACP community to support the development and education provided by us. And at the same time support our mission and vision as well in advanced practice. So who undertakes a mental clinical placement? Is a number of categories of people are who will undertake mental clinical placement. First is for those who are undertaking HEI routes, so they are doing a university MACP accredited MSc at the moment. So part of the MSc include a placement module, which is 150 hours. The second categories will be those who are undertaking the portfolio route. So for those who are undertaking portfolio routes M1, again, they have to do a 150 hours placement. And finally, those who want to do it as an option. So they don't really fall into a HER route or portfolio route, but they want to do it as part of their development or part of their one of the options, or they in one of the pathway, so they can do it as a standalone module. Before we get into your journey, we think it's really maybe helpful to refresh you about the learning outcomes of mental clinical placement. So the learning outcome is the dimension 10 of IFORM standards. I don't think that is unfamiliar to many of you, but the placement is very much to look at whether you utilize effective integration of your in-depth knowledge, current best practice, patient-centered approach, and proficiency within the orthopedics musculoskeletal therapy clinical practice, uh, your master level of problem solving skill. Again, we're looking at that critical thinking skill and problem solving skill with accuracy, precision, and lateral thinking within all aspects of clinical practice. Whether you have utilized sound clinical judgments, always think about that benefit and risk when you're selecting your assessment, treatment techniques appropriate to the patient changing environment and presentation. So when we talk about patient changing environment and presentation, it is very much about capabilities here rather than competency. Whether you critically apply efficient, effective, and safe OMT intervention in patients with complex presentations. As we know, patients do get more complex with multiple comorbidities, polypharmacies, and aging population, etc. So that is very much relevant in our real clinical practice. And finally, is to produce scholarly contribution to the body of OMT knowledge, skills, and measurement. So this is about your evidence-based practice. So your understanding about the current evidence, the current guidelines, or your local pathways, whether you can contribute that and translate that knowledge into your patient's care. So these are the 5 main learning objectives of the placement. And as I mentioned before, your learning contract as a mentee is very much self-direct. So whatever you want to learn and get from the placement, those objectives has to be balanced and linked with these learning outcomes. Okay, now I'm passing on to Caroline.
Thanks, Sharon. So hi everyone, so what I'm going to do now is talk about the mental clinical practice journey from start to finish to give you an idea of what's required in that process and what it looks like in practice. So next slide, Sharon, please. So we're going to talk about the preparation that's involved in the placement, in preparing for the placement in the months ahead. The things that you would be doing the first day of the placement to get set up ready for the rest of it, what the placement time actually entails, and then also the end assessment and what that involves for you. So we've devised a checklist to make it more simple for everyone to follow, really to help people plan their time on the run up to the placement and make sure that they tick all the boxes and get everything needed to be done, completed. Often an honorary contract is needed if you're going to an external setting for your placement, for example. So we need that in place months ahead. So 3 months before the mental clinical practice, we're looking at things like that. We need to make sure that the person has a CSP membership and is HCPC registered. Mandatory training has been completed. Immunisations are up to date. So all of those relevant things that you'd normally be required of your employer are required for the people hosting your placement as well. So what we do in advance is collate that evidence, and that's ready to show the employer or the people hosting the placement so that they're happy for it to go ahead. You would do that in conjunction with the portfolio route leads. That would either be myself or Sharon, whoever's your lead of the portfolio route at the time. We are launching a CPD-Me platform. I'll mention it now only because what we're looking to do is have all of this information uploadable onto this platform so it's really easy to manage, and that's launching soon. I'll talk more about that later. Other things you need to be thinking about is that there's a learning contract that needs to be completed, and that's including things like doing a learning needs analysis, potentially a SWOT analysis of needs, and looking at setting objectives for the placement. Now these objectives are personalised to you, as Sharon mentioned before, but they have to match with the IFOMP learning outcomes. So what we need to make sure is that the outcomes for iFont's Dimension 10 are all met by your learning objectives. So they're tailored to you, your objectives are tailored to you, but they map against that learning outcomes of Dimension 10, which we mentioned before. And we'll support you with that. So what you do is you submit the learning contract ahead of time so that the mentor and the assessor, who is allocated ahead of time, takes a look and ensures that they are mapping appropriately against the learning outcomes, because we want to make sure when you pass everything, hopefully, you have met the learning outcomes required and you move on with the portfolio route. So 6 weeks before, that's when you're submitting the learning contract. The clinical mentor signs a self-declaration. That's just part of the process of ensuring that they've completed the necessary training required to be a mentor. And then in the month before, you complete the SWOT analysis, familiarise yourself with the learning outcomes, and identify any skills that you particularly want to acquire during the placement. And that doesn't have to be manual therapy. It might be communication. It might be like aspects of clinical reasoning. It might be certain areas of body. Or certain specialty. So it's really about you and your personal requirements, what you're looking for. The next slide, please, Sharon. So the learning objectives are completed within the learning contract, and then that's signed off, and that's all ahead of time. And then we get to, and obviously there's things like the logistics of where the placement is, being able to access the placement easily, and planning the times and the days you're going to go with your mentor to make sure you're both available. So on day one, you complete as an induction record. It's really just a checklist for your mentor to make sure that everything is there in place, which has already been provided and we've communicated in advance. They review your SWOT analysis and your learning requirements and needs to make sure that the placement time is set up accordingly for what you're looking for and what your personal development requirements are. Let's check I'm not missing anything in that section. Yeah, no, they carry out a local induction in the same way that if you start a new job anywhere, you want to know where the fire exits are, you want to know what to do in case of an emergency. So it's all of those aspects of administration to make sure that you're ready to go and you're safe in that environment. The mentor and mentee will discuss the learning contract and sign it at that point. And the placement objectives will have already been laid out, but that's just signed off with a plan in place, ready to go. This one, Sharon. So when we get into the placement then, so moving on from the 3-month checklist of things that need to be done and the induction on the first day, it's then a matter of working through the documents and working through those hours and building on achieving those learning outcomes and learning objectives. There's a log of hours that are completed to record the time that you spent on the placement, and that will be, some of it will be direct with your mentor and some of it will be independent study. There's also a practical skills log, so this is again tailored to your requirements. It might be certain practical skills, perhaps related to orthopedic manual therapy, it might be specific exercise prescription, other things. They're listed and you then set a plan of what you're going to do to achieve them and how you're going to learn and develop those skills by the end of the placement. So you would log your learning related to those aspects as well. You constantly during the placement review those objectives and your skills to make sure that you're on target to reach them. And then we have, in terms of guidance, the placement is 150 hours, and we recommend that a minimum of 40% of that time, which is 60 hours, is directly with your mentor as a minimum. If you can do more, it depends on what your learning requirements are and experience before. We have produced various documents to help evidence the work that you're doing when you're doing self-directed work, and I'll talk through those soon, but they're listed there. So things like recording practical skills sessions, case-based discussions. And that will be evidence of some of the direct work you'll be doing, but you might also be reflecting on work that you're doing in your own practice and bringing it back to your supervisor to also demonstrate some indirect learning. So it might be learning you've done with your supervisor, you go off and do some learning with a
Emma,
Well,
is
I couldn't, yeah.
is that freeze from Caroline or just me?
Yeah, no, I thought the same. I was trying to work out whether it was just me or no, she's frozen.
I saw Rachel is moving, so
Yeah, no, you're moving and everyone else, there's people blinking and things.
okay, all right.
And Chris is having a little dance, so we're
All
all
right,
good.
it's okay. I'll carry on.
Okay.
I think Caroline is on the direct contact hours and indirect contact
I'll,
hours.
I'll keep
Um,
an eye on to see if she manages to
yeah,
come back in.
yeah, that's fine.
Okay.
Yes, so as what she said, we have developed a number of resources and template to support these direct and indirect contact hours. And these are probably most people ask, what do you mean by direct and indirect hours? So we have laid this out all very clear on the checklist. And of course, another FAQ is about assessment. So you will be assessed during the placement. There is a halfway formative assessment, which means you basically don't. It's not grading. It's basically trying to give you some feedback how you're doing halfway. There will be a formative assessment on a new patient and a follow-up patients. And at the end of your placement, there will be a final summative assessment, which means you will be assessed at level 7. So your placement normally carry out by a MACP assessor and your clinical mentor. They will work together and they will produce some questions to ask around the learning objectives that you set during your placement and linked back to the Dimension 10 IFORM standards. The new patient's assessment is 45 minutes and the follow-up patient is 30 minutes. And you have 30 minutes to do your Viva during that time. We're going to go for a little bit more of that. You usually receive your feedback within a week after the assessments. I think you normally have some verbal feedback on the same day. But at the end of the placements, both mentor and mentee will jointly complete the endpoint documentations. So there is a number of paperwork need to complete before you complete the placement. And as you can see from start to finish, there is quite a lot of paperwork and documentations and how you formalize your clinical placement. And I think having a checklist may be helpful for many mentor and mentees. So hopefully that could be that could be a helpful resources tools for both mentor and mentees. Is Caroline back, I think, isn't it? Okay,
Yes,
I'll
she's
carry on.
back. Yeah.
Yeah. So we have so myself and Caroline are the new portfolio route leads. We have been in post since November 2024. Obviously, some of our portfolio routes lead candidates, they are undertaking mental clinical placement. And we have been working quite hard to develop some new resources and templates. Basically, it's try to make it a bit easier for everybody, but also to try to promote some consistency and standards of documentations because you do need to formalize your evidence of your placement as part of your placement. And everyone seems to do slightly different things. We work really closely with the university course leads as well when we looking into this aspect of work. So we have developed a checklist for mentors and mentees, and hopefully that can guide everyone through from start to finish. We have reviewed the clinical mentor guidelines. What are the roles and expectation as a clinical mentor? The self-declaration form of clinical mentor. We have include some various things like the case-based discussion question makers for mentors to use. Various templates. These templates are modified from other framework like the FCP roadmap. because these are great tools and it's been validated, but we have modified for the placement for this particular placement. So things like case-based discussion template, COTS, the clinical observational tools, CAP, clinical examination procedural skills, reflective practice template, so how you do a critical reflection of your practice, and finally SWOT analysis. And hopefully that can support mentees to how they structure and organize and formalize their evidence during their placement.
Thank you, Sharon. I'm back on now. Apologies.
Okay, all right, no panic.
Thank
Technique.
you. Hotspotting, so
Go
hopefully
back
that will
to
work.
you.
Thank you. So these are some of the examples of the paperwork that Sharon was talking about then that we've developed to make it easier to record the work that you're doing on the placement. So this is an example of the case-based discussion. And what you'll see on the side under capabilities is it shows the learning outcomes that these aspects can link to help you map and demonstrate on your for the portfolio submission, but also to show that you're linking up with that iFont dimension 10. Next slide, please, Sharon. And this is an example of a clinical observation tool. So where you might be performing certain skills that you've highlighted that you want to develop, and you'll be observed by your mentor or somebody who's linked to observing you in the placement, and they will sign off and observe and give feedback on the aspects of work that you've demonstrated. And we have an example of critical reflective practice. So you can describe a situation. It might be a situation on the placement, an example on the placement, or it might be something that you're doing in your own workplace whilst you're within that placement time that you bring back and work on with your mentor and work through. So it's an opportunity there for you to demonstrate and integrate evidence base, decision making, clinical reasoning, and just a great time to step back and reflect on your work and see if you might do anything different the next time and how you might develop and refine your practice going forward. Another work that Sharon and I have been doing as portfolio route leads over the last few months is that we've developed a new mental clinical practice handbook. So there was one in 2022, so we've updated that to make it more user-friendly and made it more comprehensive, and so we've given that flow to make it an easier process to follow and understand. We've also updated the assessment form handbook, so that's again easier to follow for both mentor and mentee. And we've brought together the marking criteria, learning outcomes, and created a rubric, so a marking rubric to for the examiners to grade against. So it's going through 4 dimensions, being knowledge and clinical reasoning. So these are what you're assessed on when you're seeing patients and the examiner is watching you. There'll be aspects of knowledge and clinical reasoning, practical skills, communication, and then professionalism and ethical practice. So they all link towards those different learning outcomes of dimension 10 of the iFont standards. And this is an example, well, this is actually from the marking criteria and rubrics. You'll see at the top the learning outcomes that Sharon talked about earlier, the dimension 10 of iFont. And then further down, you'll see one of the examples, that's the knowledge and clinical reasoning example, where it's assessed at level distinction, commendation pass, and it's just the different criteria that will be given. So it's either like good, very good, and effectively to get a pass, it's the same as what is required of M-level study, so it's over 50%. Okay, so clear pass is between 50 and 59, and so on.
And I think this descriptor really helpful for mentor as well, isn't it? Or assessor when they're doing marking. So it's not their view, but it's need to be objective in accordance to this descriptor of M level 2.
Yeah, good for helping consistency with the marking, the assessor and the mentor, but also giving the mentee something to aim for, really focus on and understand the differences and nuances. And then finally, in terms of the work that we've been doing, so ongoing actions and things we're developing, is we've set up MACP mentor database. So this builds on the existing MACP member database. And if you want to be a mentor, and if you've, speak to us or speak to Elaine Deschaux, who's a mentor's mentor, and we're happy to take on more mentors if you're interested. If you're a mentor already and you're not on the register, do go in and check your profile, and you can tick if you want to be a mentor of your existing mentor, but you might not be listed as one. Tick on there, because that's how members can find you. So people on the portfolio route, people from the HEIs who are looking for a mentor, they can go and search and find you on there if you're an existing mentor. If you want to be a new mentor, what I'd recommend you do is attend our MCP Mentor and Assessor Study Day on the 12th of September. So that's available online to sign up to. The morning is dedicated to mentors, and it's about developing our mentor skills, talking about scenarios that might come up on a placement, and just developing our understanding, communication. And in the afternoon, we're looking more at the marking and the assessment and how that aspect of it works. So that's the 12th of September. So morning is about being a mentor. If you're interested in being an assessor and you're an experienced mentor already, and you've got experience of marking at M level in HEIs, then the assessment section might be one for you. Okay, and that's in the afternoon. The other thing we've been working on behind the scenes is the whole MACP team. MACP team is the CPDME online platform. Now, many of you might have heard a lot about this. There has been quite a long build up and a few delays, but that's only because they want to make it as good as possible when it is launched. And that will be available for all MACP members, not just portfolio route candidates. And it's somewhere where you can upload the work you've done, upload evidence to show that you're meeting those IFON standards, continuing in your practice. And it's something you could then use for your HCP registration, because it's a portal where everything's held together. This is also for people on the HEI routes can use this to demonstrate their portfolio in the future as well. So it's for everybody who's an MACP member to enjoy that benefit. In terms of comms, we've been looking at trying to promote and really advertise the different routes to MACP membership. So promoting the HEI routes, the portfolio routes, and just encouraging people, and also the international routes to membership. So I hope that's been clearer as time goes on. And if anyone's got any questions, obviously, please do ask about that. And finally, there's been an update to the MACP clinical mentoring webpage to make that more accessible, and so people can understand what they need to be learning and understanding if they want to be an MACP mentor. Thank you.
Okay, so me and Caroline, we have gathered a couple of FAQ about mental clinical placement, and hopefully that may answer some of your queries. We do have a Q&A at the end of the webinar tonight, but these are some of the very commonly questions we're being asked. Okay, so how many hours? That is probably the most frequently asked question. 150 hours. It's not all direct. It's the minimum direct contact hours will be 40 hours. So it's laid out very clear on the checklist what is meant by direct contact hours. Essentially, it's your time spending with your mentor. Okay, patients contact, case-based discussion, court, etc. In direct contact hours, it's make up the rest of the 60%, which could be things like you're doing your reflection, or you're doing some research literature, reading, self-direct learning, or shadowing other clinics, etc. So sometimes it's quite hard to differentiate between the both, because you may overlapping, but it's just very important to keep that record about your lot of hours, because we do chat about not just your 150 hours, but to reach that requirement at the minimum of 40%. The good news is it is very, very flexible. Okay, so you can't do this 150 hours as flexible as you can. So some people take a whole lots of time to do their placement. Well, some people, they may do it 2 days a week for so many weeks to make up the 150 hours. Some people decide to go away from their workplace to do their placements so that they can learn from other clinicians. And some people, they decide to do it within their trust, because it could be a very massive MSK team. They can be able to go to have that in-house or locally to be able to meet their objectives. So it is very, very flexible in that sense. Next question, where do I do my placement? It could be local, around where you are, where you live. It could be away. So some people like to away to other region to learn from the expert of that particular area, or they want to look at develop particular practice in different venue, which is fine. It could be in-house, so we do have some services because the MSK service is quite big, is very diverse, so they can provide those service and MSK specialty which fulfill the objectives of the mentees, or a bit easier with work-life balance, etc. And and some people basically want to learn from particular clinician that want to learn from. So they may want to spend some time of their placement with that particular clinician as well, which happen to. So again, it's very, very flexible, and hopefully that could suit most people. Next, what are the eligibility requirement to become a MACP mentor? So I think a lot of people out there who are thinking, wanting to be a mentor, you're thinking you may have lots to offer from your experience and want to further demonstrate or develop your education pillar. So this is it. It's really clear. You have to be a full MACP member. You have to complete a free online e-learning modules for clinical mentoring, which is available on the MACP website. Ideally, you have experience in master level assessment and mentoring. Not necessary, but it's desirable criteria. Good news is there is a support available to all clinical mentors through our MACP mentorship lead. So again, it's all about to develop you as a mentor as well, and we are having support from MACP for that.
Right, so where do I source an MACP mentor? So for your placement mentor. So there's various ways. So I talked earlier about the directory, so that's on the MACP website. If you search the directory, you can tip that you're looking for a mentor in the advanced search, and then it will give you a list of mentors, and with that it will give you their profiles, so you can see what areas of MSK, what specialisms they're interested in and they work within. So that's a good place to start looking. If you're with a HEI, then your course leads will often have a local resource available of mentors that they commonly use. So that's a good place to go if you're on a HEI, but you're welcome to come to the database with the MACP as well. So hopefully people will be on both anyway. Portfolio route leads, so if you're not sure or have any questions, or there's somebody that you think you'd like to watch but you can't see them listed as a mentor, do come and ask us. We're happy to try and set things up and explore possibilities. And then it might be within your own professional networks. You may know people in your workplace or locally, people that you've heard of before who have offered mentorship placements who you want to go and spend time with. So there's various ways. So how is it assessed? So with the portfolio route in terms of assessment for the mental clinical practice, so what I didn't say earlier, but at the halfway point of your placement, you'll have a formative assessment. So that would be your halfway assessment, where you can choose to either have a new patient session or a follow-up session where you are under the example of what an exam might be. So under those conditions of an exam, you're watched by your mentor. At that stage, you're not watched by an assessor, just your mentor. They watch you in practice. They can fill out the rubric and give you specific feedback afterwards to help direct you in the second half of your placement. And then when you have your actual assessment, that's normally within the last few days or last week of your placement, depending on how it's distributed. We provide an MACP assessor, and that's somebody you will know ahead of doing the placement, because they're the ones that also check off your learning objectives to make sure they tally up with the learning outcomes of IFONT. So you would have your MACP assessor and your mentor attend that assessment. And on the assessment day, you have a new patient session that is watched by both of them, and that's normally 45 minutes. And then after that session, there's 15 minutes to just take a moment, reflect on the session, write notes, and then for 30 minutes you have a viva about that session. You have the same thing then with a follow-up assessment session. So you have 30-minute follow-up, 15 minutes to write notes and reflect on the session, and then 30-minute viva. And so that happens on your assessment day. The questions that you have in the viva are generally directed around your own learning objectives to make sure that you then fulfill the dimensions of iFont, and they'll be using marking rubric when they watch you and when they conduct the viva, to make sure that you're mapping against where you're mapping on that marking rubric. The assessor and the mentor jointly agree feedback together, so they discuss together the session that you've had and come together to give verbal feedback on that same day. It may be both of them, or it may be just the mentor providing that, and then within 1 week they'll provide more formal written feedback, which is idea is to be very constructive for future practice, because we're all learners in the MSK world, aren't we? We never know everything, and there's always more to develop. And it's nice to know where we're doing things well, and it's nice to know where we can focus our development for the future. So that's what that is aimed to be at. And then how do you evidence your 150 hours? Well, that's using a lot of the documentation we talked about earlier. So there's a log of hours to record your hours with your mentor, and there's direct hours, so you sign off the hours that you've spent on the clinical days with them. And you want to be specific about direct and indirect contact when you're recording it, so it's clear and transparent. Using the templates to formalise and demonstrate the learning, particularly when it's the indirect contact time, is really useful and really important. And also the practical skills log, where you're developing certain specific skills, is a good way of demonstrating evidence as well, and time spent on the learning for your placement. The mental review and sign off the log of hours at the end of the mental clinical practice, but it's good practice as well to, if you're doing a few days a week, to be looking at it at the end of the week and signing off as you go, so it's not one big thing to sign off at the end, particularly if you're spreading out the hours over a longer period of time. Okay, so now we're going to move on to talking to Lucy Dove, and I'd like to welcome Lucy Dove to the webinar, who has recently been undertaking a mental clinical practice placement with us on her MACP portfolio. So we're going to just explore Lucy's experience and see if we can get some learning out of her for you all and find out more about it. So thank you, Lucy, for joining us today.
You're very welcome.
Lucy, do you want to introduce yourself to everyone?
Yeah, I'm a physio, an MSK physio, and have been for some time. And then I've worked in spinal practice for the last 4 years. And then in the last year, I've moved away from clinical practice, and I'm currently doing a PhD that's related to clinical practice. It's on lumbar radicular pain and sciatica and weakness in the leg. But yeah, the PhD is actually, funnily enough, been my opportunity to do the clinical placement. So yeah, we can talk about that a bit more.
Yeah, thank you. So I guess my first question for you, Lucy, was what made you want to do an MCP placement?
Yeah, good question. It's something I've always wanted to do, but never really had the opportunity, never really had the time, I suppose. I did my master's at Hertfordshire, started in 2015, and did that very much part-time alongside clinical practice and having a busy home life and family life. And yeah, I just didn't have the time to fit it in to do the clinical practice, but I desperately wanted to do it, and I felt it was a shame I didn't do it. But I got my master's, but didn't do the clinical practice. So yeah, I wanted to go back to do it. And another thing I think was that I was in a triage role. I was a spinal triage role, and I felt like I was losing touch with some of those fundamental aspects of being a physio, losing some of those rehab skills, and I wanted to get back in touch with that. And I wanted to enhance my spinal learning. I felt like maybe there was more for me to learn. Yeah, and those are the main reasons I wanted to do it.
Thank you, Lucy. I don't know if anyone who isn't muted, can you make sure you mute yourselves? I'm struggling to mute people. I don't know if Emma might be able to. Thank you.
Yeah, I've sorted that.
Thank you, Emma. All right, thank you for that, Lucy. So in terms of, you've obviously completed pretty much all of your placement now. Has it been what you expected it to be now that you're coming to the end on reflection?
Yeah, it's fulfilled a huge amount for me. It's been absolutely fantastic doing it, and I wouldn't hesitate to recommend it to anybody who's thinking about doing it. I think there has been some things that I probably wouldn't have expected. I thought I would be doing more triage, but actually it really has got me back in touch with rehabilitation, because working with Sam, she was all about starting that rehab journey with the patient from that first consultation. So that really helped to reignite my fire of being a physio. It really has enhanced my communication skills a lot. That's been fantastic, and that's not something I really expected it to do. I thought I would be maybe doing my manual handling skills and using lots of manual therapy skills, and that's not so much what I wanted to get out of it. So I was really thrilled that actually it built on my communication skills, non-verbal communication skills as well, my listening skills, things that you will do in your clinical practice, but you will miss because you don't have another pair of eyes and ears in the room. And it's just having somebody else in the room to say, when you were head down typing just then, they were doing this, or they were looking like this, or they asked you a question, but you actually missed it because you were turning the next page, or you were doing something else. So yeah, it's been fantastically helpful in so many ways. Yeah.
Great, lovely. I guess final question is, do you have any tips for anyone who might be thinking about doing a placement?
Yeah, I would say don't hesitate to organize it to suit your own needs. And that might be hugely various for every individual. It might be a career aspiration that you want to fulfill by doing it in a specific area, or like you said, with a specific person, or it might be filling a gap in your career that you never had a chance to fulfill. So yeah, I just think everyone could sit down and think how they might tailor it to their own needs. And I think everyone shouldn't be frightened of doing that, because you get out of these things what you put into them. And I think if you put a bit of thought and time into planning it and making it your own, then you'll get more out of it that way.
Okay. Thanks so much, Lucy. That's so helpful.
Thanks, Lucy. It's really positive to hear your experience. Right. Okay. Right. Shall we answer some of the questions on the chat box? So
Do you want me to go through them for you?
Actually, we go through the last slide, and then I'll stop sharing so I can see everybody.
Okay.
Yeah, I think it's a really, really good point about the placement could be very flexible, and if we can put a bit time and planning how to do clinical medical placement, that would be greatly beneficial. And that's the whole point why we looking at all the resources, is to make it a bit easier for people with that journey from start to finish. So in summary, I think it's aimed, the placement is very much to provide that self-direct structure and supportive clinical placement for MSK professionals. It's really an opportunity to nurturing professional growth in advanced practice, to have time to reflect and refine your own practice. Also, it's an opportunity to benchmark your clinical practice against international MSK standards, which is IFORM standards. It could be for those who are doing their HEI route, portfolio route 1 and 2, or as like Lucy, who are those who want to do it as options. It could be a very positive and rewarding experience for both mentor and mentees. And finally, it's being part of that MSK community. I think that's really quite nice to be able to support that vision and missions of advancing practice, or even the next generation of MSK physio coming along to have this level of standards training. Okay, so let's do a few questions here. Emma, have we got any? Shall I bring the chat box up?
Yeah, I've got a few. So we've got two from Ashley. First one was, in terms of the MSc qualification, does it have to be one of MACP accredited, or can it be an APP relevant masters? Any APP relevant masters? That was her first question, or his first question. I don't know. Their first question.
Are you asking about portfolio routes here, Ashley?
I don't know.
Okay. If it's so, if you want to join the MACP through the
Member.
HI routes, it needs to be through an MACP accredited HI pathway. So they're available on the website if you're looking to join. There's a space where you're like how to join the MACP, and it talks about the HI routes and the universities that offer those accredited masters qualifications. And if you don't have those, then the portfolio route is the one for you. And if you do have a master's, then you'd either be on a relevant masters, which one of the AP masters would be. Then you would be either route 2 or route 3, depending upon your experience. And you can use the evidence on your masters to map against the IFONT criteria.
And then the next question was from Ashley again. Is it possible, which you've already answered, I think, is it possible to do your placement at your place of work if there is a mentor available?
Yes, it is possible. Although we do encourage people to think about their objectives as well, their self-direct objectives, as much as they want to be a bit easier. But if you have a suitable mentor at work, and they will be able to fulfill your self-direct learning contract, yes, that's fine.
Okay.
I will say often people have or sometimes people have split placements where they might do some in one place and some in another. That might be it's worth thinking about that as an opportunity to think, well, do I want to do it all in-house, or is there something I'd like to learn, or someone I'd like to spend time with, or the service I'd like to spend time in that I can bring back to my place of work and enrich my place of work, but also enrich your own experience of the placement, rather than do it all in-house where it might be very familiar.
Right. And then the next one's from Chris, and it's, how much does it cost to do the placement? One first part, and then the second part, how much should be paid to the mentor?
If you're a portfolio route candidate, the portfolio route fees already include the mentor clinical placement. So it's nothing coming from the candidates, because the fees of the portfolio routes already include. And also, as a portfolio route candidate, you don't have to pay the mentor as well. That will be between MACP and the mentor. And your mentor or the service who provide mentorship, they do get reimbursement to support the placement.
Great. And then the next one's from Lucy, and she was just asking if the templates would be available on the website.
Yes.
Yeah.
Yes, sorry.
Yep.
Yeah, and they should be available on the CPD.me platform as well, I think. But at first, probably the website.
Cool. And then also another question, just saying, may I clarify, for the new patient assessment, is it 45 or 60 minutes for assessment itself, and then is it 15 minutes before the Viva?
It's 45 for the session with the patient, and then it's 15 minutes that you have to write notes and just take a moment to reflect on the session, and then the Viva is 30 minutes.
Great. Then, so there's some new ones now as well. Rachel has asked, for the indirect learning spending time with other specialists, do they still have to be MACP members? And also, if spending time with other specialists is to do things like supervised injections for another course, can this be used for indirect hours too?
I think with the mentor, you need to have one MACP mentor, which is full member, but you can have another mentor who are not MACP member, but they need to demonstrate master level of advanced practice. In terms of spending time with other specialists. Spending time with other specialists to do injections, like supervised injections, that is probably indirect contact hours, but in terms of that, I think you need to revisit the learning outcomes of the placement itself. Whether would that be linked to your the dimension 10 learning outcomes as well as your learning outcome from that particular placement. But it will be something, if anything, it will be non-direct contact hours, or it could be like self-direct learning. So for example, if you got a patient who want to offer other things like treatment options, injections, then it's maybe something you go away and you research about it, or you observe other specialists. So that could be part of your 150 hours, but it will likely go under the non-direct contact hours.
Then, great, thanks, Sharon. Another question from Rachel is, if we do an MACP accredited MSc at a later date, will we need to do another MCP for that, or will this MCP count?
So, sorry, say that again. So if they did the portfolio...
Sorry, so if we do, so Rachel said, if we do an MACP accredited MSc at a later date, will we need to do another MCP for that, or will this MCP count?
This wouldn't count because it's not linked. Well, no, yes, no, it wouldn't count for the university because this isn't university accredited. So the portfolio route placement is not university accredited, so you can't take, there's no credits to take to another university, and they will have, the universities have their own way of mapping against the learning outcomes for all of the modules. So another university wouldn't say, for example, solely use dimension 10 of the IFOM standards as their learning outcomes. That might be outcomes from other areas that they need you to cover. So other universities might have a bigger module for the mental clinical practice, and it includes a submission of like some sort of write-up or reflection piece to do with the placement as well. So it would be different. I would say I'd recommend, if you're thinking about the HEI route, to do it all within that HEI to get the best experience and the support out of it, rather than do it for us first.
Cool. Thanks, Caroline. And then Rachel's got another question. She says, last one, sorry. That's all right, we like questions. If a placement is planned but ends up having to be extended, i.e. mentor is off sick, etc., will this impact on the MCP, or will the MACP assessor be able to alter the dates they come in for the summative?
Yeah, they would alter the dates. Yeah, these things happen. So yes. Yeah,
cool. And then there's another question, a couple of questions. Can I do my MSc online because I'm overseas?
The MSc is in a HEI route.
I'm not sure that.
Is it HEI route or portfolio route?
The portfolio route, we do have overseas people. We do it remotely.
Yes, it doesn't actually specify, and then it just says, do courses studied on Physio Network really count in achieving FCP/app status, APP status, sorry?
Well, if you do a university route, like the course route, that will be a credit, a MACP master in advanced in MSK, but the MSc will be met against the IFOM standard, which is accredited to the advanced practice MSK standards. And that is the same as portfolio route. For the successful completion of portfolio route, which you can do it overseas, although we're looking at some long-arm supervision at the moment if people need it. Then again, the successful completion of portfolio route also equivalent to the MSK Advanced Practice Accreditation, because it is met against all the IFOM standards. And IFOM standard is the foundation of all other MSK framework in the UK. So yeah.
Okay, great, thanks. And there's one question that I just missed that was further up from Claire, saying, if you already have an MSc in advanced physiotherapy, is the portfolio route recommended?
Yes, that will probably one of our most popular candidates to come in to do portfolio route is they have done MSc elsewhere, not the MACP accredited one. So if you already have a full MSc, then portfolio route will be a ideal way to become a full MACP member. It will be depends on how many years you have been doing MSK to decide whether you'll be on route 2 or route 3. So contact us if you want further information.
Yeah, so sorry, can you hear me there?
Yes.
Yeah, so it's basically I'm FCP APP spinal,
Yeah.
and I recently did my MSc with the University of Hertfordshire, which they did use the iFOMPT
Okay.
to score the MSc,
Mm-hmm.
the HEI ones. So it would still be the portfolio route, and it would be just a placement only of the 150 hours. Is that right?
You have done a you have done a MSc, which is assessed.
Advanced physiotherapy. But what happened was it changed because I didn't do the placement on the MSc. So when you don't
Mm-hmm.
do the placement, you don't get the MAC membership.
Yeah.
Yeah.
So then I completed the masters because the placement didn't work at the time due to family and everything else.
Okay. Yeah.
And
Yeah.
then they said, oh, you can go through the MACP and choose an alternative route to do that after you finish your masters. So that would be the portfolio route, basically, the one placement, 150 hours. Yeah, that right?
That would be, you would still have to map, use the evidence that you have from Hertfordshire to map. But if you've done some of those already approved MACP
Yeah.
modules, it's going to
Probably
be
fully
easy to
mapped.
map. And that's sort of what Lucy did.
Okay, great.
Earlier.
All right, thank you.
So you do
Thank
have
So
to do all the
just the place,
mapping, but
just the
it really,
placement,
yeah.
you. Thanks.
just the
Do you
placement.
want to add anything to that, Lucy?
Yeah, no, it's exactly what I did. I'd done my master's, it was done and dusted. I didn't have to go back and do anything, but I couldn't become a member of the MACP, and that's the main reason, yeah.
Mm.
Okay, thank you.
Thank you.
That's all the questions on the
I know we've gone over time, but if anyone does have any other questions burning there, do
yeah, that's
ask
all the
Mark.
chat. That's all the questions on the chat. So, and also if anyone does have anything, obviously they can email me if they want, and I can pass on anything that if anyone's got anything they need to ask or clarify or anything.
Okay, that's fine. I
Thank
think
you,
that's
everyone.
good. Thank you so much, everyone, for spending an hour of your weekday evening. And I hope this is helpful for you guys in terms of mental clinical placement tonight. And we're looking forward to hear from you very soon. Thank you.
Thank
Thanks.
you.
Good evening.
See ya.
Bye, everyone.
Bye. Bye, Rachel.
Bye. You having a nice time?
I am.
Good. Well, enjoy the rest of it.
Thank you.
See
Bye.
ya. Bye.
Bye.
Yeah, thank you, Anata.
You're very welcome.
Thank
You're
you.
welcome. Thank you. Elaine's here.
Bye,
Do you-
Elaine.
Do you want to stop recording, Sharon? Do you want to stop?
Oh, yes.
Yeah.
Yes, please. Yes.
you.
Thank you. Hi,
Um,
Elaine.
Well done. Hi. No, I was just going to say, brilliant. Well done. You both did really well. Honestly, it was really good. Very